Hi there, my name's Darcy, and recently I caught up with Dr. Catherine Mummery, the head of novel therapeutics at UCL's Dementia Research Centre. Before we jump into the episode, I think it's important to first define what dementia is. It's not a disease itself, rather it's actually an umbrella term for symptoms of declining brain activity, things like memory, cognition, and behaviour. According to the World Health Organization, over 55 million people have dementia worldwide. The most common type of dementia is Alzheimer's disease, and right now, there's no cure. Although, as you'll hear in this episode, there are some exciting developments in this space. Dr. Catherine Mummery truly is at the forefront of this search for dementia treatments. In this episode, we talk about promising drug trials, ultra-fast MRI scans, and the revolution in dementia care that we need to have. But first, I wanted to know what motivated her to get into this field of work.
So I've always been interested in the brain. I did a psychology degree before my medical degree. But when you start to see people that have dementia and you see them gradually lose themselves and their families lose them as well, it's a really heartbreaking thing to see. So part of my motivation to going into treatment trials was to try and change that. Because the other thing is, it's so common that we all know someone who's got Alzheimer's, and many of us will eventually develop it. So if we can try and find a treatment that makes even a little difference, that will make a massive change to those individuals, but also to our society. So I think it's an imperative that we try and find these treatments.
Dr. Mummery's role at UCL's Dementia Research Centre means finding these treatments is exactly what she and her team are trying to do.
I have been doing clinical trials now for around 15, 16 years, and it's changed an enormous amount in that time. What I do, in essence, is try and find treatments that change the course of the disease in things like Alzheimer's disease and frontotemporal dementia. And so we test new treatments and new therapies against targets within those diseases. So this is where we have really groundbreaking therapies or therapy candidates, and we use them to try and treat people for the first time. So first time we're giving them to human beings. And those therapies target different proteins in these diseases like Alzheimer's disease.
In recent times, 2 drug candidates have been making headlines around the world. Their names are lecanemab and donanemab. Both target a protein in the brain called amyloid, which is heavily implicated in diseases like Alzheimer's. I asked Dr. Mummery how exactly these drugs work.
There's one drug that has been approved in the States, and that's lecanemab, and they're looking to approve that drug in other countries, including here. Donanemab has just shown phase 3 results that are at least as good as lecanemab, so is highly likely to be approved. So we will have drugs that do change disease in the coming year, 18 months, if they're approved by our regulatory bodies. What those drugs do is they target a protein called amyloid in the brain that is a very early triggering protein in Alzheimer's disease. And what they do is try and mop it up and so prevent accumulation in the brain. And what we've seen from those drugs is that it can give you perhaps 5 or 6 months extra of better quality of time over an 18-month trial. So that's not nothing for somebody that's progressing. They want time at a better quality of life. And these drugs are the beginning of that. Now we just need to work on that and get more efficient drugs.
Another treatment that Dr. Mummery has been working on for some time and that is also showing incredible promise is a gene silencing drug called BIB080. In terms of what it does and how it works, I'll defer to her to explain.
BIB080 is a really exciting drug. We started studying this in 2017. This is a gene silencing treatment. So what it does is, instead of the existing treatments that we're just starting to see come through, they mop up proteins that have been produced already in the brain. These gene silencing treatments work upstream of that. So what they try and do is prevent production of those proteins in the first place by modifying the production of proteins from the gene. And the first treatment trial that was done in Alzheimer's, we started in UCL. We put the first patient in the world in UCL in 2017. And we just published the results of that first phase 1 trial, which showed that we can, using this gene silencing, reduce production of tau, which is one of the proteins in Alzheimer's disease. So that's really exciting. And we hope to take that to next stages.
And in terms of what those next stages are?
So the next stage is, firstly, we've shown it's safe in a small number of people. So there's only, there's less than 50 people in the world that have had this drug so far. So the next stage is to give it to hundreds of people and to show not only that it's safe in that group of people, but also that it can change your clinical function. So it gives you benefit in addition to reducing the proteins. So that's the next stage, and we've just started that.
Dr. Mummery's work isn't just concerned with drug treatments. Another groundbreaking trial she's involved in has to do with MRI scanners. These are critical in the diagnosis and monitoring of people with neurodegenerative diseases like Alzheimer's. The problem is, not enough people who need access to MRI machines have access to them. And while one solution would be to have more scanners, another, more efficient solution would be to make them faster, without compromising quality.
One of the reasons that we struggle with being able to diagnose people sufficiently and also with these potential treatments coming along is we don't have enough MRI scanning. So a lot of people in local memory services don't even get an MRI scan in spite of the fact that it's essential to make the right diagnosis. Now, with more treatments, we're going to have more people that need more early diagnosis, so it's critical that we improve access to MRI scans. A standard MRI scan takes at least 30 minutes. So we've developed a technique called ultra-fast MRI that can now reduce that from 30 minutes down to around 5 minutes, which you can imagine makes a huge difference to the numbers of people that you can getting access to those scans. And also, if you're a patient stuck in a scanner for 30 minutes, that's really uncomfortable and some people can't do it. So if you do this to 5 minutes, many more people will be able to tolerate it. And so hopefully many more people will be able to have treatments.
By now, you've probably captured that it's an exciting time with several dementia treatment breakthroughs on the horizon. But Dr. Mummery is quick to point out that developing these treatments is one thing. Being ready to administer them is another.
The fact that we have treatments coming down the pipeline now that are going to change dementia means we really have to have a revolution in the way that we treat people with dementia. At the moment, our services aren't fit for purpose. If those treatments turned up right now, we would not be able to give them to the people that need them in the right way and safely. And so it's a tragedy that we haven't had these treatments for so many years, but the real tragedy is that we have them and we can't give them properly. So we have to change our services. And right now, NHS England and other bodies need to focus on how to do that. What I'm really passionate about is that we develop a network across the country where we build bridges, where we don't keep in our castles. And that way we'll improve both our services and our research for all of our patients, wherever they live.
It's an important call to action for collaboration. To finish our chat, I asked Dr. Mummery what role UCL has to play in the fight against dementia.
UCL is a unique place in terms of the way that we work. Our research and our clinical functions are embedded within each other in a way that in many centres they're not able to do that. We also have extraordinary cohorts of patients, whether they have Alzheimer's disease or frontotemporal dementia or other diseases, which we can use to really understand the basis of those diseases and then use those to plot potential treatments. So UCL as an entity needs to continue to encourage and build those links from basic science through translational research to clinical implementation and work with UCLH so that you get those things working together. And I think if we can do that, then as UCL will be the lead of a national network for translational research in clinical trials in dementia, they can really show that they're a flagship for how this should work.
A big thank you to Dr. Catherine Mummery for shedding some light on her groundbreaking work in the search for effective dementia treatments. You can learn more about UCL's interdisciplinary approach to dementia via the link in our show notes. Thanks for listening.